Thank you for your interest in the Rural Health Clinic program. You have accessed Part 4 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. The cost reporting for flu vaccines and Medicare bad debt session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the RHC program, please access Parts 1 through 3 of Medicare Cost Reporting for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health. This is Part 4, Cost Reporting for Flu Vaccines and Medicare Bad Debts. The first thing that we're going to talk about are flu and pneumonia vaccine reimbursement. Oftentimes in a rural health clinic, staff will say, oh, well, we're not paid for flu and pneumo vaccines. Well, that's not true. What you need to do is you need to keep a log of all of the patients that receive a flu and pneumococcal or pneumonia injection for the year. What happens is these are then reimbursed on the cost report. And through the cost report, it will include staff, the cost of the vaccine, and overhead costs. What would be included in overhead costs would include syringes or any other types of expense for such supplies. These services, when you do a flu or pneumonia injection, you should not be billing it to Medicare. As I said, what you do is you make a list. It will list all Medicare patients that received the flu or pneumonia injection. It should include their name, the Medicare number, their Medicare number, and remember those numbers are now changing. It will no longer be their Social Security number with a letter behind it, and then also the date of the service. The other thing that will go along with the cost report are vaccine invoices. Those must be submitted with the cost report. So if you're a provider-based RHC, it's possible that you are not receiving the invoice for those vaccines. It's possible that they are going to the hospital, and you will then have to get those invoices from the hospital to be able to keep that with your list of patients. One of the things that's asked oftentimes is if Prevnar is reimbursable. Prevnar is the same as the pneumo vaccination, and so therefore that is also a reimbursable cost. So Prevnar, pneumonia, influenza, sometimes they're called the flu or the pneumo, those should all Medicare patients should be kept on a list. And when that cost report is filed, they are then sent in with it. This screen is just an example of from a benchmark report. All of the cost reports are submitted to CMS, and we are able to download some of that information. You should always be looking at the cost of your vaccines on the M series of the cost report. Because as you can see, this particular clinic had $8,401 in what they said was the cost to do the pneumococcal injection, when the average for the nation was $221. That $8,401 is not comparable, and it sticks out very much. So therefore, this clinic, before submitting their cost report, should have gone back and taken a look and said, okay, something's not right. And then, as you can see here also, the cost per influenza injection is very low compared to the national average. Their cost, they're saying, was $48.56, and the nation is $73.84. So as you are doing your flu vaccines and you're reporting it on the cost report, you should look at it as a comparable to the prior year. And did the cost of the vaccine itself go up? Do you maybe have some staff that were included that shouldn't be included? So it's really necessary to take a look at that, because you are reimbursed cost, but this is the only way that you get that reimbursement is through the cost report. Another thing we want to talk about today is Medicare bad debt. What is a bad debt? It is the coinsurance and the deductible that you are not able to collect from the patient. Oftentimes we will ask rural health clinics, for a bad debt listing, because once again, it is a list, and they'll say, well, we didn't have any. It's very unusual for any clinic not to have bad debt. Honestly, you're not reimbursed 100%, but you are getting 65 cents on every dollar that you list for that allowable bad debt. 65 cents per dollar is better than zero. As I said, it's only for the allowable, deductible, and coinsurance amounts. It does not cover things that were not part of that RHC visit. It does not cover what Medicare didn't cover. It is only the deductible and coinsurance. So in that, some of the services that would not be covered would include your lab, radiology, if they had an EKG or something like that, that are non-RHC services on the cost report. So you have to do a reasonable collection effort. You have to document that you did this and that it was consistent with your other collection policies. So if you attempt to collect on coinsurance and deductible for all other payers for more than 120 days, you must also do that for Medicare patients. You must follow your collection policies. It cannot be less than 120 days from the date of the initial bill to the patient. So as you can see, it is not when the patient was seen, it is when you sent the bill to the patient. CMS is now insisting that if you turn over these uncollectible accounts to an outside collection agency, the account cannot be claimed until it is returned from that collection agency. They are of the feeling that if it is with the collection agency, it is still considered to be collectible. Here is the actual criteria for allowable Medicare bad debt. It has to be related to the covered service, okay, and derived from deductible and coinsurance. So the patient came in for an E&M. They have a copay and they have a deductible on that claim. You must be able to establish that reasonable collection efforts were made. So you have to have in the notes for that patient that you did send them the collection letters, that you did try to call them, or whatever the other processes would be that you would use for all other payers. That debt must be actually uncollectible when it's claimed as worthless. And the other thing, you have to use a sound business judgment when you determine that you no longer can collect on it. What are some of the other reasonable collection efforts? Issuance of a bill to a responsible party. So if you are not issuing that bill to, the patient, say that it is going to someone else that is taking care of their bills, you must show that you are issuing, that you are trying to collect for that party. It might include subsequent statements. It might include collection letters and telephone calls. And the collection agency cannot just return claims for Medicare patients if they do not return claims for other payers. So you can't say after 120 days you want all of the claims, Medicare claims, returned from the collection agency. However, you don't want the Blue Cross or Humana claims back, because that would not be consistent with your policies. You have to use the same collection procedures. One of the other things is that if the debt does remain unpaid more than 120 days, the first bill is mailed to the beneficiary. That is the day that, it starts to accumulate, it starts to count for the 120 days. Not when the patient was seen, not when you billed the insurance company. It is when the patient is billed. There are instances when you can claim bad debt without waiting the 120 days, and that is in the case of an indigent patient. Okay, so if you have a patient that has filed for community care, that would be considered an indigent patient in your files, and you do not have to wait the 120 days. You can write that claim off as soon as it becomes patient responsibility. Another time is if the secondary insurance is Medicaid. According to CMS, beneficiaries are considered indigent if they are eligible for Medicaid. You do need to bill Medicaid. You cannot skip that step. But as soon as you receive the EOB from Medicaid, you can then write the coinsurance and the deductible off. Once again, it cannot include labs, radiology, or other non-RHC items. It is only for coinsurance and deductible. And you also have to determine that there's, you have billed with proper insurance. Secondary is Medicaid. So once those are determined, you can write that off. These are the only instances that it's allowable to write off coinsurance and deductible before the 120-day collection period has ended. So again, you're going to have a log for both the pneumo and flu vaccines, and you're also going to keep a log for your Medicare bad debt to be able to submit with your cost report. Thank you again for your interest in the Rural Health Clinic program. You have participated in Part 4 of the 4-part session entitled Medicare Cost Reporting for Rural Health Clinics. For additional information about the RHC program, please access Parts 1 through 3 of Medicare Cost Reporting for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health.